Hello and welcome everyone to the pitches here at the Innovation Week with Giant Health. I'll be moderating. So I'm Matthew, the head of ecosystem at Lead Sports, who are a global sports and health tech VC, and oversee all the early stage life cycle of companies. But however, we're here for some amazing startups. Each company will have 5 minutes to pitch, followed by some time for questions, which you can write into the chat. So yeah, without further ado, I think we can kick things off. And I'd like to introduce Bloom Health, who are a software-first digital health platform. They're on a mission to connect healthcare excellence with technological innovation. I think this is becoming all too important as healthcare shifts to a hybrid model. So yeah, please welcome Dr. Michael Watts and his team to the virtual stage.
Thank you, Matt, and absolutely amazing introduction. So thank you. So thank you for having me. So amid the COVID-19 pandemic, there's never been a better time for clinical innovation. Yet the barriers still remain. Grant funding is scarce and thus difficult to win. Techie co-founders are few and far between, and procurement sits at the summit of mountains. We are Bloom Health, and we are here to change that. I'm Dr. Mike Watts, a medical doctor turned clinical entrepreneur and innovator. And as a trio startup with my tech co-founders, feeling the idea to reality struggle, we turned our focus to supporting SMEs launching their products and large organizations going through digital transformation, finally filling the world with high quality, high impact software solutions. By turning our focus away from a single product that was very much a non-priority during COVID and meeting needs that healthcare organizations required to keep providing value to their patients, we were able to ideate, build, and sell 2 COVID products within 6 months of inception, which got us thinking. If we nurture collaborations and we're flexible to the needs of the client, supporting them from idea to reality, and enabling their projects through all the barriers I've mentioned previously, then this is how we meet our desire to build software that is 3 things: patient-centric, scalable, and impactful. Our business model is one of simplicity and flexibility. We manage each of our projects in isolation with dedicated teams nurturing that collaboration based on their needs. We were only able to do this because of our team. We realized that by investing in our key asset, we could not only work on our own innovations, but provide close to home support for the organizations at the same time. We have access to a talent pool of developers with over 100 years of experience, and by keeping our UK-based workforce at over 50% software engineers, we aim to always stay ahead of the curve when considering resource. Tie that in with our experience within the healthcare systems, and the value that you can build from such a team is truly astounding. Collaborators often come to us telling us what they and their users want. We then get our team of designers and innovators to deep dive into their idea to realize what they and their users need. By using research-driven decision-making and reusable design strategies, we can iterate with our collaborators to ensure that their build is the most efficient but most impactful solution possible. And finally, this is where the magic happens. Our secret sauce software architecture allows us to take the pyramid approach, giving collaborators a version of their software which is robust and secure, but in a timescale that is highly competitive. Then we provide a support system to scale the service based on the needs of each collaborator. So now I've told you what is important to us. Let's focus what's important to you, the patient. We couldn't do what we do without practicing what we preach. So in our Bloom Lab, you will see patient-centric, scalable, and impactful software solutions. This recent project took a piece of research from the University of Liverpool, whereby corneal topography should no longer require a specialist and £50,000 pieces of equipment. Yes, with our software and the university smart device, anyone can now read the surface of the eye with a smartphone, allowing rural parts of India and Nepal to access the care they deserve. And this is currently in clinical trial phase. Where Bloom's values are missing, we fill them. Whether it be a thought leader with a solution for an unmet need or a corporate organization requiring digital transformation to their clicks and mortar organization, we mold to the needs of our collaborators. Here is our most recent collaboration with AgilePath, who, with our support, are going to revolutionize the way that pathology requests and tests are processed. Patient-centric, scalable, and impactful. Finally, having felt the startup struggle ourselves, we could not ignore the need for truly pro bono support in medtech. We decided to set up the Bloom Propagator in March of this year, whereby 3 solo entrepreneurs joined us to go through the design phase of their solution, taking them to a point where they could better define the opportunity to funders or better define the benefit to patients through visual designs and prototyping. We hope to run this again in the coming months, and you can register your interest with us at any time. So that's us. Basically, we're an offspring of an innovation hub, a software development company, and a medtech accelerator. And as we continue to grow, we hope that we can support those around us to do the same. Thank you.
Thanks, Michael. That was definitely a great pitch. So just a reminder to everyone that you can write any questions in the chat. But I might just kick it off really quickly. I think it's a great global health solution, as you mentioned. So just being able to capitalize on hardware that's readily available, phones, etc., to provide needed diagnosis and democratize healthcare. Well, what would be your core product offering right now? So you mentioned the cornea topography. Is that what your main focus is, or how are you scaling?
Well, to be honest with you, Matthew, we're doing a couple of things. So whilst we continue to scale our own innovation, so the corneal topography, like I say, is in clinical trial phase. But while we continue to build on these innovations of our own, we look to support other organizations get their ideas off the ground too. So that really, we provide that resource to organizations that have those skill gaps missing, recognizing that these projects that we're working on, like the corneal topography one, which is high impact, but there's lots of things we need to cross, the chasm that we need to cross as an organization. We recognize that takes time. So whilst we're working on that, we're also supporting other organizations at the same time. So the ultimate goal is to have a few innovations of our own. Corneal topography is the prime example at the moment, but also support others.
Yeah, and I think corneal topography is a smart first go-to-market, being able to get that information on your phone, but also it's needed in different patient groups, such as diabetes, such as people who are suffering from microvascular diseases. Like there's a lot that can be diagnosed through the eye, believe it or not. So yeah, I think it's actually really smart.
Thank you.
Yeah, and then just a second question from me: is it a B2B model? So are you approaching doctors and clinics and partners, or is there some way where it could be readily available to a patient directly in the future as well?
So the idea is that we want this to delocalize the need for such devices to be in big eye hospitals. So having to travel hundreds of miles in places like India and Nepal is just not possible, particularly at the moment. So really giving taking that burden away from the specialist and allowing those that have sufficient training but nevertheless can be guided by the software. It gives them the opportunity to handle that. So it really is something that would need to be adopted by more rural hospitals. We could implement that quite throughout those hospitals. So ideally B2B, because there's an element of safety and security that comes with that. If we can make it consumer led eventually, then that'd be fantastic. But I think right now the safest bet would be to still keep it in the hands of healthcare professionals.
Yeah, no, that's really good, and I think it protects the brand integrity around the product as you go to scale as well. Keeping it, incubating it within the medical fields.
Absolutely.
No, that was really good pitch, guys. I'm interested, so I'm sure there's a lot of other people watching who are interested. So, I hope you get a lot of outreach from this. So, so I'll just quickly introduce our next pitch. Thanks to Michael and the team at Bloom. Our next company, they slot seamlessly into this new omni-channel approach to health, nutrition, and well-being as well. So I really feel that Life are cracking the code for reward-based diet and nutrition monitoring, again, connecting all the pieces, the people, the physicians, and then the partners, because the interventions are so important as well, and helping us to just live a bit better. So yeah, I'd like to welcome the team from Life to the stage.
Good afternoon, everyone. Thank you, Matthew, for that introduction. Yeah, good afternoon, everybody. My name's Ed, and I'm one of the co-founders of our company called Life. We're a team of doctors and health tech experts creating the first complete online wellness social platform that exists in the world currently, with the goal of completely changing the way that we, as individuals and as a society, approach our health. So let me get into a bit of background as to why we're doing this. Fundamentally, for whatever reason, I'm based here in the UK, but also globally, we focus on our health as from a negative health paradigm perspective. And what that means is we wait for something to go wrong and then we try and treat it. This has very poor outcomes. It's very costly. Individuals don't like it, and it's not the future, essentially. So we need to change our approach and come at our health from a wellness and a positive health paradigm perspective. So what solutions are there currently? Well, it's a really long, complicated journey. I'm sure you can relate to this. Actually, looking after your health is very, very complex, and there's digitally, there's so many solutions out there as are popping up on your screen. You've got Mind Body if you want to book fitness classes. You've got MyFitnessPal if you want to track calories. Evergreen Health. You've got Instagram if you want to look at your local partners, local gyms or local health eateries. You might go into Google, scrolling through Google, trying to find some answers. You might download Headspace or apps like Calm, or scrolling through Deliveroo, trying to find more healthy food, or YouTube. It's honestly exhausting. And considering that the average phone user downloads 0 apps per month, we need a better solution than this, frankly. And that's why we've created Life. So Life is it's a full wellness ecosystem. And if you imagine that your physical health high street around you, what we've done is we've taken all of those healthy activities around you, vetted them, and placed them online onto a single platform. We vet it all as doctors. It's very prevention focused, and it can address all of your individual health needs within one place. So it's very streamlined. So on the left there, you can see that this is your personalized feed. So we've got built-in algorithms to see what healthy activities you're already doing and what further things the app can recommend for you. It's highly geolocated. So, you might see 200 yards down the road that there's a healthy place that you haven't seen before. It's been vetted by ourselves as definitely being healthy. You can click it, you can book some food, you can, say if it was a gym, you could book a class, you could watch the videos. There's absolutely everything you can do, and you can buy products and services. It's a one-stop shop for everything healthy in your local vicinity. And why does this work? Well, we've built on the 3 biggest trends in the past 100 years. Convenience, this is the single biggest trend in the world since the 1920s. We want things faster, we want things quicker. We've built on personalization. We now have a bigger demand for experiences rather than services. People want the information and the products and services they receive to be personalized to them. And finally, it's social. What is the one thing that brings you back to every single app? It is social aspects. Think WhatsApp, Instagram, Facebook. These are the biggest apps in the world for a reason. And there you go, there's Life again. So now I want you to take your individual hat off and put your corporate hats on. This is YOGACITA. So this is a yoga studio in Liverpool. Now, they have similar issues actually as our end users, and they are that YOGACITA, ran by Lucita, she has to use loads and loads of apps to actually put her content online to reach new audiences, and she's spending a fortune on it. It's not streamlined, it takes her a long time, and she can't actually see if it's getting her any rewards. We have solved all of these issues for her by giving her the retailer dashboard within Life. She can see her views, her top trends, add content, put offers on there. It's again that one-stop shop for all of her business needs. She absolutely loves it. The feedback we've had so far has been truly overwhelming, and we're absolutely made up ourselves, and that's why we have over 15,000 users waiting to get onto the app. But we're going through testing phases now. We're just trying to make sure things go slowly and we don't ramp it up too quickly. Here are the 8 key categories that people must do in their lives to live healthily, and our scaling plan fits in within this. So as you've seen YOGACITA, she fits into the brown icon there, which is mindfulness. And we onboard retailers in each of these 8 key areas from city to city. The market is huge. There's £13 billion last year in the UK alone, and it grows anywhere between 16 and 24% annually. So, average around 19% per year. So the market it's one of the fastest growing markets in the world, because it is frankly the future of health. Our biggest competitor, called Glowfox, owns a 0.11% share of the market, and last year they turned over 18.5 million. They raised almost 33 million since their inception in 2014. We have a myriad of revenue streams, typically subscription-based for users and for retailers, and we do some work outside of that as well around well-being days for corporates.
Yeah. Ed, just to let you know, there's about 20 seconds left. Okay.
Okay, thank you. We've had a £100,000 grant given to us by the Liverpool City Council. We've been accredited as an LTR Tech Climber. This is our roadmap this far, and we've achieved everything up until the end of May. And we've got a highly competent team with a myriad of experiences. Our CTO's worked for the global brands such as IBM and Universal Music Group. So I shall leave you there looking for £150,000 SEIS money to achieve product market fit. And this quote: "What LinkedIn is to your profession is what life is to your health." Thank you very much for listening. If you've got any questions, please email me or look at our website. Thank you.
Yeah, thanks, Ed. That's really interesting. Definitely in a super cool space as well. I think, as I mentioned in the intro, I think, you know, the gym isn't the center of the universe anymore. It's more of this omni-channel, multi-faceted approach, and you seem to hit each of those verticals on the head. My quick question is: 15,000 users on the sign-up list or waiting to be part of this is amazing. How many B2B partners, so on that kind of intervention side, like that yoga studio, do you have? Are you working with at the moment as well? Just because they probably provide that initial piece of value in the short term. As you scale, your users will then obviously provide parallel value.
Yeah, absolutely. We've got around 150 waiting. Currently on the app. Testing now is 15. We're trying to keep the beta testing phases quite a closed group. And as we're collecting the feedback, you know, we're building it along the agile methodology. So, you know, we found that retailers have found certain features of the app really useful. So we're building that into the app with less clicks. For example, you know, they find a certain feature really useful, we're making it a forefront on the platform. So when as we push it out to more retailers, the things that they typically do, we understand a bit better. But that is just in Liverpool so far. So you know, we've almost saturated Liverpool, but we really want to make sure that we have everything honed down solid before we move on.
Okay. Yeah, that's really interesting. And again, just checking the chat here to see if anybody sent anything else, because I probably have 100 questions. It's part of it's what I do every day is speak to startups. But yeah, just quickly then, because I know we brushed lightly over the revenue model. So just if you could remind us of that for the last kind of minute here.
Sure. Yeah. So well, as a company, we do lots of other things. You know, we do well-being for corporates. We have wellness packages for universities, schools. But if we focus purely on the technology, it's a freemium-based subscription model, both for the users and for the retailers. The price has gone up significantly following on from the feedback we've had. The retailers actually said they would pay 20 times more than what we initially thought they would, which is obviously great news for us. And then depending on how many services that they use within the platform, you know, the price changes. If they want to upload videos, offers, booking system, you know, depending on how many features you take, the price goes up.
So
for the user,
feature-based SaaS kind of.
Yeah.
Cool. Yeah. Perfect. Cool. Thanks so much, Ed. That's really interesting.
You're welcome.
Yeah. Cool. Right. We'll push on and we'll introduce our next team. So when I was looking over this in the brief, I thought to myself, imagine having a real-time coach in your ear, and I think that's arrived. So Dukes are improving athletic performance, I think, one word at a time, and they're on a mission to empower a world where all athletes can access sports and be the best they can be and achieve their personal goals. So yeah, really excited to learn a little more, Nikolai.
Okay, thank you. Well, hello, and thank you for having me. It says Jukes is a hardware company with a mission to empower all people to participate in sports for mental and physical well-being, then go on to do extraordinary things, as you said. Jukes needs to be in your portfolio if you believe in our mission and are looking for a high-impact investment with a solid return in this growing wearable space. So what do we do? Well, this is Lincoln. He is deaf and has been a keen swimmer for 2 years. In October 2019, his club bought a single headset so Lincoln can hear the coach's instruction at the same time as everyone else. The first time he did, his mother was on poolside in tears. This is possible because we have waterproofed bone conduction speakers, and using radio, we can transmit audio up to 750 meters away. To date, we have focused on the swimming market and can be found everywhere, from COVID-19 PTSD recovery programs with referrals from the NHS to a European national team training with Jukes for the Tokyo Olympic Games. Now, there are many problems, but this is the one Jukes solves for. We know a lack of real-time communication means fewer coaching minutes each session, resulting in slower improvement and eventually premature dropouts because you're just not inspired and you're not winning. People lose their motivation and are more likely to drop out when goals are not being hit. So did you know in England, just 15% of girls aged 18 are active, and amongst boys it's 26%. And our obesity rate is forecast to be 50% by 2050. So this is also a health and wellness problem. So we put coaches and supporters in radio contact with athletes on land or in water to give them the encouragement, technical and strategic guidance they need to achieve their goals and do extraordinary things. So this is the headset we sourced from China and has got us this far. The specs are no longer innovative, but we are helping coaches and athletes get closer. So there's been a lot of activity on Instagram, from amateur clubs in the UK through to New Zealand. And Dr. Gary Palmer, who just recently has started using Jukes to increase the fitness of international athletes from triathlon to football. So we've done amazing things with clubs around the world, with our 14th country just added. The bulk of our business is in the UK, which was recently given a boost with a commercial deal signed with the Swim Teachers Association, allowing us to offer our tech exclusively to their 12,500 members and their 56 member countries around the world, including massive sports markets in the US, Australia, and China. But this is our future. For Lincoln and tens of millions of athletes between 8 and 80. An innovative headset for multidiscipline sports above and below the water with IoT connectivity, lightweight sensors, and a breakthrough adjustable fitting to suit all heads in all sports. This is what your investment will bring to life and be sold to the $16 billion sports coaching market that sits inside the hugely exciting $450 billion sports market that are full of potential acquirers. I'm also very proud to announce that as of Monday afternoon this week, Jukes has been accepted to Loughborough University's Advanced Technology and Innovation Centre, giving us access to their vast research and sports resources and EU funding to bring manufacturing back to the continent. So the idea of real-time communication in the sports coaching environment is actually quite novel. And 100% of our 1,200 sales to date are from word-of-mouth recommendations and customers posting on social media. Unlike our most interesting competitor, Milo, who have spent 3 years designing their walkie-talkie replacement and yet to release a product, or Finis and Zygo, who designed a product first and now trying to sell it, you are investing in a team that have learned a lot in the past 3 years about what a great sports training headset needs to be to break out beyond a single sport with eyes on the prize, that being our global sport of football. So today we have a simple business model selling through our website with payment upfront. However, we're signing our first dealer in Amsterdam and we've just started trialing an option to pay 40% upfront and split 60% of the balance over 12 months for purchases over 5K. This is hugely promising as we've seen those original order values double. My team is small but effective, but for those interested in getting to know us, we look forward to meeting you when restrictions allow. Here I want to highlight the resiliency this business has shown, considering sales during 3 UK lockdowns went to almost zero. We have continued to grow with the numbers in the grey box split by quarter for this financial year. Our gross margin is an average of 41% and operating margin 26%. And forecasts for the next 2 years exist and will be discussed with any interested investors. So today we are asking for 275k, offering a 20% discount on a convertible note, which will be transacted through Seed Legals. We are also submitting a second bid for up to 225k from Innovate UK to further develop software-defined radio. After all, I come from telecommunications, and software-defined networking revolutionized the industry. Thank you very much for your time. I look forward to your questions.
To our investors who are here today, they're more than welcome to turn on their cameras and ask some questions as well. But I'll kick it off just to begin with. What challenges do you see in your roadmap being a hardware first company?
The biggest challenge is coaches that are not optimistic, they're not innovative, coaches that don't yet believe it. So we have seen incredible success only because coaches have recommended it. So this is a product which needs to get a bit of a beachhead in a sport with some key coaches, which is what we've done inside swimming, and we spent a good couple of years doing that, and that's the way that we will continue to roll out in future. Other challenges relate around supply chain and manufacturing. As a hardware company, we have our relationships in China. At times they've been very difficult, but the future for us needs to be to own the IP of this hardware, own the design and the innovation roadmap, and not have to, honestly, from a margin perspective, not have to pay the duty involved in a product of origin outside of the EU. And that's a really significant impact on margin right now. And
is there the potential to integrate other pieces of hardware to optimize this? So thinking kind of there's one company, Flex, in the swimming world that were the first to bring an integrated heart rate monitor to goggle-worn sensors. So just thinking of the positioning here, how would you see that?
Yeah. So the current design that is proposed is a headset which moves on from an innovative point of view from where we are right now, but it has been designed to allow space for a heart rate monitor. And because we're going to have IoT connectivity, including potentially Wi-Fi inside the headset, there will be a replacement Pro product, a second product, come along shortly afterwards based on the same look. So we're not going to re-spend everything redesigning and retooling. But it is going to have a heart rate monitor inside of it. There is also scope for a GPS. Because outside of sports, there is an application for short range in the context of sort of 1 kilometer in manufacturing, agriculture, large logistic sites where it's very difficult to stay in contact with people, with the alternative today usually being issue everybody mobile phones or very expensive IP radio sets, which I come from telco and do understand that. So that's why GPS is something for another headset and why we're chasing software-defined radio.
Yeah, no, that makes sense. It's great. It's great to see that there's a software end to it as well. And then just for the last minute, is there any other investors who want to turn their camera on quickly and maybe ask one question?
Yeah, if I could jump in there. Nikolai, thanks for the presentation. Just from my side, a question: where's the upside? Where's the true blowout potential here? Because I mean, the market you described, I wouldn't argue that there's a need, but it seems fairly niche. Is there any scalable potential for the technology beyond that initial market that you're describing?
So thanks, Edward. So the initial market being sports coaching, where there's a relationship between two. In terms of where this could really go, from a hardware point of view, for us, the solution we think is a headset that is scaled down and is not intended to just be about a coach and an athlete relationship, but actually an athlete listening to music, listening to coaching sessions being delivered, pre-recorded, using connectivity and the headset, but it won't have the need for all of the radio equipment inside of it. And that's a case of connecting to Wi-Fi at your local or your phone at your gym or your pool or wherever your place of sport is, and stream content delivered by amazing or high-profile coaches around the world, kind of starting to touch on the peloton of far more sports than just a riding machine.
Cool. Okay, thanks,
Cool.
Nikolai. I think we can move on to our our next startup. So drill surgery is really interesting. They are bringing AR and algorithms to the operating theater to not only vastly improve patient outcomes, but also reduce hospital expenses and outpatient department expenses. So yeah, I'd like to hand over to the team at Drill Surgeries.
Hello, everyone, and thank you, Matthew, for the introduction. Let's start from the beginning. So, hello, and welcome to Drill Surgeries, the startup working to improve healthcare through technology. And to do so, we move one step at a time. First, focusing on a common type of surgery, intramedullary nailing surgeries, aimed at assisting the welding of broken bones in femur, tibia, or humerus. This surgery is performed over 200 times a year per hospital in the UK and so around the world. In this surgery, what is known as an intramedullary nail or rod is inserted inside the patient's bone to assist on the welding. Well, the issue is that the current method relies heavily on X-rays, and there is an excess of radiation shot at patients and medical personnel. Now, the technique used is a trial and error method, which proves to be inaccurate and time-consuming, meaning there are risks derived from blood loss and long-acting anesthetics. All of this is happening right now in a country spending close to £50 million a year in these surgeries, around £6,000 per patient, where most of the amount comes from room charges, since patients need to spend around 10 to 15 days at hospitals post-operation. Our solution, though, already shows potential to reduce hospital admissions as it ensures fewer risks during the operation. And if this is true for the UK, and of course our research goes further than just this country, it is also true for our target market, every hospital in the world, because we all know someone somewhere who broke their leg or arm at some point of their lives. In over 2 years of research and development, we have seen and spoken with dozens of doctors from Spain, the UK, Switzerland, Australia, etc., that keep preferring a freehand or trial and error method technique on these surgeries rather than relying on mechanical or electromagnetic guiding systems offered by competitors, which are coined as inaccurate. All of them, though, showed an inclination to welcome a new medical device for this surgery. And that is what Drill Surgeries provides. A solution built with the constant input from surgeons and for surgeons. Making use of the latest technologies, our prototype implements augmented reality and tracking algorithms, offering real-time and 360 degrees guidance without the need of radiation, reducing then operating time and risks caused by the more traditional approach. And we are not only offering safer and faster surgeries, but also with fewer risks. Patients stay less time in hospitals, and hence we can reduce cost per patient, which at 200 surgeries per hospital per year amounts to a substantial number. The team making this happen today includes myself, starting the project when I was heavily involved on world-class physics research in Switzerland, a chief medical officer, that has performed this surgery for over 10 years, and Henry, an aerospace engineer that led the development of the fully working prototype that is already showcasing promising results. In the past 2 years, we have received support for the value of over £30,000 from several organizations and institutions, startup incubators, and even startup competitions like Santander X, which has nominated me to participate in the Entrepreneur of the Year Awards, where I will be speaking at Wembley Stadium in October of the same year. We are finally in a position where we are looking to raise our first formal round of investment for £150,000 to grow our team, improve the software side of the prototype to satisfy the levels of accuracy we strive for, and start testing the device by Q4 2021 or Q1 2022 on bodies at hospitals we are already in conversations with. Thanks a lot for your time. Thank you.
A lot, so I want to first open it up to any investors on this stage who'd like to turn their camera on and perhaps ask a question.
Hi, yeah, then I'm happy to jump in and take the first shot. So thanks for the presentation, very clear structure. So you mentioned, at any place of the world, someone who break his or her leg. Can you tell us a bit more about your go-to-market strategy? So you start first with the UK, you start in other European markets, and how do you approach those potential customers? So how do you approach the hospitals, and who is in the end paying for the solution?
Definitely. So that's a really interesting question, Marco. Thank you. So this project started in 2018 in a conversation in Spain with a series of orthopedic surgeons which were experiencing these problems. I come from a very scientific but also technical background, and so we were discussing how to better improve the way surgeries are done. Now, fast forward to 2021, we are working to make this product a reality. The way we make this happen, the way we aim to bring this product to market, is that at every stage of our development, we work and collaborate with surgeons. So not only the surgeon that started the company with us, but at the same time, a series of advisors that we work with that include ex-chairs of the NHS in the UK or respected members of the SECOT Society in Spain or heads of hospitals in Spain and other countries. So thanks to this huge collaboration between us as the research and development startup that's developing something for surgeons under the requisites, the expectations of surgeons, as soon as we've got this product ready, then they will be the ones testing it because they are the ones helping to build it. Once they test it and they prove that their problem, the one that they approached us with, is solved, then we only need to ask the hospitals to formalize this type of agreement between us as a private company and the hospitals, which, if private, should be a smooth transaction, and if public, will have to go through a series of commissioning steps. Now, this could be the approach on countries where we already have contacts at, and we are aware that introducing a new product like this in markets where we do not have a physical presence or a social presence, as everything is virtual at the moment, will be tricky. That's why we, at the same time, work very closely with medical device commercial houses, those houses that sell the medical devices from other companies, and at the same time, in conversations with other companies, which we aim to approach as we finish Q1 of 2022, to start and formalize a series of agreements where they can take care of the inclusion of our product on markets where we do not have a presence yet.
Okay, thanks. Yeah, it's, thanks for this, for those insights. And approaching hospitals is always tricky. From my point of view, the last point you mentioned, talking to medical device manufacturers might be a potential sweet go-to-market strategy, or when it comes to Germany, somehow finding angel with a strong background in hospitals, either probably more from the business perspective, probably leading or running a hospital in the past. This might be probably a gate opening, because it's very tricky. But so I'm interested to follow your journey. So thanks for those insights.
Thank you, Marco. Like in the end here, we are trying to diversify our ways to market as a way to optimize our entrances in these markets and bringing the product to the hands of those that want it in the end.
Really interesting. I'll just follow up really quickly with how long do you think the sales cycle will be then?
The sales cycle. So the way we were structuring our product, it's on the one hand, it's the physical product, the device that surgeons will use to be guided during the surgery, so that they do not need to rely on x-rays through the whole process, nor on a trial and error method. So we've got the physical device. This is a device that will sit on the operating theater.
Yeah.
And this is a physical device, so you pay a one-time payment for the use. Now, at the same time, for each of these surgeries, you need to make sure that the product is protected and it's sterilized to make sure that the patient is receiving the best care possible. So to do that, we have designed our own type of plastic covers that are going to be used to protect our device from the environment and ends for the patient. So that's one use per surgery element that needs to be purchased in order for it to be safe to use through the whole process. And then at the same time, since we rely heavily on software, and software is something changing and that exponentially improves year by year, we want to provide the same services, not just year by year, but month by month. That's why the software side of the product is going to be sold as a subscription-based product. So as we improve our software, the hospitals will receive the best support they can receive. And
I'm just going to quickly interject because I'm watching the clock also, but it's still a really good answer. I think we should introduce the last startup of this particular leg. Obviously, there'll be a few more startups later on today, and that would be with minime Health. So again, in a really interesting space, I think the cognitive health market has been doubling every 2 years since 2014, and expected to be worth over possibly 12 to 13 billion in the next 3 to 4 years. And I think minime is part of this growth, and they're creating a digital toolbox for therapists. But again, I'd like to hand over to the team to give you guys the best explanation there.
Thank you for this very nice introduction. We're happy to present here today.
Perfect.
Great. Okay. So, hi everyone. My name is Nina, and I'm a co-founder and developer at minime. And we are on a mission to digitize and gamify psychotherapy tools. So why are we doing that? More and more people benefit from therapy nowadays, as you just said in your introduction, including our whole team. So it's a great way to reflect, analyze, and relearn certain behavior. But how does CBT work in 2021? Traditional therapy didn't change at all over the past 30 years. It's about drawing on flip charts in session and filling in paper logs at home. Those paper logs are complex, not very appealing, and simply don't work in the patient's daily reality. No wonder 40% of people in therapy are actually non-responders or dropouts. And of those who go through therapy, a huge percentage also tries again and again because their therapies are not successful. All of this obviously also creates a lot of costs for our healthcare system. Asking more than 20 therapists what their biggest pain point about the current situation is, all of them said the same 3 things. No transfer from sessions to daily life of the patient. There are no digitally available materials, and especially not enough focus on the exercises. This is where minime comes in. A digital interactive toolbox for therapists to create, share, and analyze exercises with their patients. With minime's modular approach, you can use customizable templates to create exercises that fit your individual therapy structure. You can create them once and use them again and again. These exercises can be assigned directly in the app to the patients who complete the tasks at home or on the go for the next session. The detailed analysis of the homework can be done together with the patient during the session, and the therapy plan can be adapted accordingly. This is saving therapists up to 20 hours per month of prep time. Plus, it improves the quality of their therapy, which they are obligated to by law. And last but not least, the gamified approach of the CBT exercises is motivating the patients to play an active role in their own healing journey, reducing dropouts and non-responders in the end. As we have seen, there's a huge gap with the potential through digitalization and the daily life of a therapist. This results in a vacuum for therapy material that minime aims to fill now. Our platform will be classified as a medical device data system, which makes our time to market extremely short, and we could have our first paying customers in the beginning of 2022. Plus, our market is growing and will continue to grow. International online therapy is booming, and this private therapy market is even more focused on making their therapy sustainable and efficient. To enter the market from all sides and become impactful very quickly, we have different market entry strategies according to our target group. In cooperation with training institutes, we will offer free student plans, while ambulatory therapists will enter through a subscription model. We will start with the one most widely used exercise template. In 2022, we will grow our library to cover even more treatments, and we'll start another module where you can develop fully customized exercises on your own. In 2023, we'll have additional modules like a diagnostic feature. This will be combined with an international rollout. All over Germany, we have a market of 27,000 therapists in ambulatory settings, paying a monthly subscription fee of 40 euros. This market can be even enlarged through targeting the coaching industry, international therapists, and other digital therapy solutions that came up during COVID. Of course, we're not the only one in that market. You can already find really good standalone solutions for patients who are not in the traditional therapy settings. But there's no integrated solution for the real in-person therapy setting, except for paper logs by a few publishers. Minime is filling that gap through combining already successful methods with modern tools that are super flexible. Right now, we are testing our wireframes and creating an extensive business plan. Until September, until we have our funding still, we want to have the first MVP ready and tested, and we want to secure funding to take minime to the next level afterwards. At minime, we are an interdisciplinary team. Together, we have experience in business, development, and even a therapist in-house. So we have got what is needed to build our product, except for the cash. If you see any possibilities to support us, please feel free to contact us anytime. In case you want to know more about minime, check out our website or sign up for the newsletter to get all the latest updates. Thank you so much.
Cool. Thank you so much, Nina. That was a great pitch. So yeah, again, for the last 3 or 4 minutes, would like to open it up to any investors who want to turn on their cameras and ask any questions.
So, I don't know, maybe I jump in here. I haven't asked the question yet, and I guess it follows on to the last question of the last pitch a little bit. Can you, have you already a strategy or plan about your sales strategy or a sales plan in terms of, will you have a sales force going to the basically therapists selling the solution? Will it be a solution they can just basically subscribe online and implement themselves? Will there be a training necessary for them? Because I think it all, I guess, is about customer acquisition costs on that side and then the lifetime value there. I would love to understand that a little bit better.
Yeah, that's actually a great question because we have been thinking extensively about this as well. We have a huge network within the ambulatory therapist settings, as our co-founder is a therapist himself and just recently finished his training. So he has close contact to supervisors and also other therapists. Plus, he's working still in the training institute. And we have a collaboration with the hospital that he worked in to test our product. So we are very integrated in the network already. And we realized that the market is very personal between the therapists. So we are in these kind of very personal newsletters. So we'll go over these and over word of mouth in the beginning. But then, because my background is also in performance marketing, which is working really well B2B, especially in niche product markets. So we will probably enlarge our market, and when we go to the private coaching market, we will probably go over the performance marketing. But in the beginning, we will keep our customer acquisition costs really low over our personal network.
And would anybody like to jump in for the last question of this pitch track?
Yeah, maybe I'll jump in for that dubious honor. Thank you for the presentation, and thank you for the I guess the description of the product. What is the main benefit, if I understand it correctly, is digitization of, let's say, an existing pathway for patients. How do you protect that, and how do you make sure that you guys are coming out on the winner, or is the market big enough for multiple players? Because there seems to be a very limited amount of protectability in the product, if I get it correctly.
Yeah, so the market is not huge. That's you got this right, but there actually is a bigger market than you would think in the first place. So Paul, our therapist, he already published a card game that is being used in therapy. And this has been sold over 1,000 times in the first few months. So the need for therapy materials is actually there, and the need also therapists are very eager to really educate themselves on new methods and to really get a connection to their patients. So this is what's always underestimated here. It's not about like them just saving money, but also really improve their therapy, even though they might have enough patients anyways. But they are sitting with the patients over 2 years in the same room. So they want to get them better. They want to heal them, and they want to really get this connection. We are the only ones, because all of the tools that are out there in the market are focusing just on the patient. But for us, it's very important to really focus on this connection between the therapist and the patient, because a huge factor in the high dropout rates is the bad connection between the therapist and the patient. So we are focusing on this. And since we have the insights and we have talked to so many therapists, we are actually quite secure that we will be the first in the market, and it's about trust as well for us. So we are quite sure that if we are the fast movers in this case, we'll get in there and we will get a higher benefit for them as well.
Cool. Really excited to follow your journey. And I think you guys are also Berlin based as well, which is cool. But yeah, that's this track of the pitch sessions. So again, I hope to see everyone back here in 30 minutes. But until then, please enjoy the next panel discussion at the end of digital health. So I'm sure that'll be an interesting one. Yeah, thanks.